All right, you're welcome. We are still on the course PhD 124 Substance Use and Abuse. So we go over to the next topic. The topic for today's class is commonly abused drugs and substances in the community. Commonly abused drugs and substances in the community. In our last lectures, we looked into the concept of drug use, substance use, misuse, and abuse. So now, in this lecture, we are going straight to the commonly abused drugs and substances in the community. So I'll just pick them and explain them in detail, so we don't waste time. So the first one, we already know what drug abuse is, so we're not going into drug abuse again. We move straight to each and every one of them. The first one I want us to look at is alcohol. Alcohol is everywhere. Alcohol is one of the most commonly abused substances worldwide. Worldwide. Why? Because it is legally available and is socially accepted in many societies. So because of that now, it is the most commonly abused substance. So if you take alcohol in excess, it can lead to impaired judgment, coordination, you lose your coordination, and even you have issues in decision making. It will affect your decision making abilities. That's what alcohol can cause. Now let's look at the health effects of alcohol in all. Alcohol can lead to liver diseases such as liver cirrhosis. Yes, of course, alcohol can lead to accidents and injuries because you lose yourself. You don't know what's happening in the environment. Especially when you are under the influence of alcohol and you're driving. Sorry becomes your second name because you won't even know. So it can lead to accidents and injuries, and also lead to hypertension and heart diseases. It also lead to mental health disorders. So the effect is not a good one. There's nothing good about it. So if you use chronic alcohol consumption, or let me use abuse, not even consumption, chronic alcohol abuse is strongly associated with dependence and social problems such as violence and even poor work performance, according to WHO 2022. So please let us note that, okay? So alcohol, there's nothing good about alcohol. So the next substance I want us to talk about is tobacco. That is nicotine. Tobacco. Tobacco is consumed through cigarettes, pipes, even smokeless tobacco products. There are some smokeless tobacco products. So nicotine is the active ingredient. That's why I said nicotine. Nicotine is the active ingredient in tobacco. And nicotine is highly addictive. Nicotine is highly addictive and is cancerous too. So what are the health effects of tobacco? Lung cancer. If you get packs of cigarettes, they will tell you that. You see where they draw. You recently see the diagram of the lungs, and they'll tell you that it can cause lung cancer. That's why they'll tell you that tobacco smokers are liable to die young. But still, people still take tobacco. Why? Because of this addiction. Nicotine is highly addictive. Even when it is written on the pack that you die young, that it can cause liver cancer, it's cancerous. Still, people will look at it, buy the whole packet, look at it, and see all these things, and still consume tobacco. Addiction is the cause. Nicotine is highly addictive. Tobacco can cause chronic respiratory diseases, can cause cardiovascular diseases, and it can reduce life expectancy. Tobacco smokers are liable to die young. According to WHO 2021, tobacco use remains one of the leading preventable causes of death globally. So let us note that, okay? Now, the next substance I want us to look at is cannabis. Cannabis, marijuana, Indian hemp, cannabis. So cannabis is commonly abused among our adolescents and young adults. In fact, it's everywhere now. They will use it to compete with each other as if you are a strong guy. They boast that there is a strong guys that use it. What type of I don't know how to express this. So if you look for what you should boast with is cannabis. Okay. So it is usually smoked or can even be ingested. Yes. Why they use it is because of the psychoactive effect, highness, illusion. You know, because of the psychoactive effect, person will feel high. Euphoria. Yes, that's the right word. Euphoria. What are the effects? The effect is euphoria and relaxation. You feel that you have no problem, your problem is solved. Without the problem is still looking at you. When you are down from your euphoric height, your problem is still waiting for you. It cannot solve your problem. It only makes you feel as if everything is alright. So effect is euphoria and relaxation. Impaired memory and concentration. If you see someone that is exposed to cannabis at a tender age, those people they rarely become somebody in life because of they lose focus, concentration is zero. I mean, those that are even there are some adults, there are some people that even studied it in their adult age and it get their life scattered, disorganized. They cannot do something and do it well and focus on it. They lose concentration. It can lead to the effect of anxiety and psychosis in severe cases. A lot of mad people on the street because of exposure. There are people people have idiosyncratic people have idiosyncratic effect when exposed to some certain substances. Idiosyncrasies exist. So there are some that once they don't take small of the cannabis, they run mad. Some even start misbehaving. So people differ. So that's why on the street you see mad people on the street. A lot of them are exposed to these drugs. So it's not a good thing. So you can have, in severe case, anxiety can lead to psychosis. Of course, you don't need to do that. I think I have mentioned that. It has an effect as students. I'm talking to you now as students. It has reduced academic effect of reduced academic or even occupational performance. Reduced academic or occupational performance. You cannot concentrate to do something meaningful. You can't concentrate. It's a problem. So, we as students of public health, these are things you should do because tomorrow you start going for outreach to tell people to save people from this menace. Very important. So according to the National Institute of Drug Abuse 2020, long-term use of this drug may affect brain development, especially among young individuals. It's clear. So let's look at opioids. Opioids. This is what opioids are also one of the commonly abused substances. Opioids. So opioids we are talking about here include substances like heroin, codeine, morphine, tramadol, and other prescription painkillers. In fact, in many communities, this use of opioids is increasing significantly. People misuse opioids. When I was in community practice, before I ventured into lecturing, you see people that time when they had not banned the codeine, people were coming. I had to stop it because even though it nearly cost me problem with my boss, but I had to stop it because I want the pharmacist in charge, so I have to do the right thing. I have to stop it. They will come and say, please give me cough syrup with codeine. I don't want to mention any brand. Cough syrup with codeine. Initially, I was like, why are they asking for this? Until I now started looking into it. I found out that I watched them look when they don't want to come to the pharmacy, they go to the attendant. So I have to make it compulsory that anybody that comes into the pharmacy, that came to the pharmacy to look for codeine, they should add cough syrup plus codeine. They should have sent the person to come and see me. So they started sending them to me because of what I saw. I saw, before I could come out after seeing a patient, I noticed that somebody bought that cough syrup, went outside, opened about 2 bottles, and drank the 2 bottles and sent down. I was shocked. So that was what led to my saying, no. I now have to work on that. So they were sending them to me. I was discouraging them. That was what I could do in my small community practice as a public health personnel, because pharmacists are also public health personnel, because drugs get to the public. So that's what I want. The little I could contribute, I have to stop it. Even though it affected the business, because the owner of the business had already bought cartons because of how people were buying, youths were buying this cough syrup. I don't want to mention any brand name. But thank God it has been banned. They don't put codeine again in custom. It has been replaced with another pharmaceutical, with another drug that can help to take care of what codeine was actually doing in cough patients with cough. All right, let's continue. So, what are the effects of opioids? The effects, pain relief. If you watch, opioid is a different, is another word. We are not going deep into pharmacology. We are just listing, we are just enumerating some commonly abused. So I don't want to go into opioids, but just know that the example we have like morphine, codeine, and what have you. So, what are the effects? Yes, we know opioids, and they are what? Analgesic, pain relief, wonderful. But they also cause sedation. They cause respiratory depression. So when you now see when they are now abused, what will now cause? Even when you use, they can cause respiratory depression as side effect. What will now happen when they are abused or misused? It's a problem. Have you now seen why government is against the abuse? There's high risk of dependence and overdose. In fact, addiction, not just dependence, addiction. And there's problem if you now want to withdraw. So there's withdrawal symptoms when the person wants to discontinue. Withdrawal is a different topic. When we go there, when we get there, I will explain what the withdrawal is all about and the symptoms that associate with withdrawal. So opioid use has become a serious global health issue crisis because of what? Increasing addiction and overdose. Because of the deaths recorded from what? Increasing addiction and overdose. This one will keep increasing overdose until the person dies. So it's a problem, very big problem. Now the next substance that is commonly abused are the stimulants. What are stimulants? Stimulants are substances that increase brain activity and alertness. Makes you to be alert. Increase brain activity. They are stimulants. Examples of stimulants are cocaine, amphetamines, methamphetamine, and even some improperly used energy or performance enhancing drugs. So these are examples of what? Stimulants. What are the effects of these stimulants? They increase energy and alertness. They elevate heart rates and blood pressure. They cause anxiety and aggression. And there is risk of cardiovascular complications. So if you use these stimulants repeatedly, it may lead to your psychological dependence, and even mental health disorders. Please let me note that, okay? Now, the next one I want us to look at are the sedatives and sleeping pills. Sedatives and sleeping pills. This one is, they are also abused. Examples of them, we have your benzodiazepines. Yeah, diazepam, lorazepam, then the trazepam, they are under benzodiazepines. Example include benzodiazepine and other sedative medication. They are normally prescribed for anxiety or insomnia, but they are misused. In fact, this one we misuse. People misuse that, misuse it on a daily basis. Now they just walk into will be tied pharmacies that sell these things and dispense these drugs without prescription, or even pattern medicine shops that I don't know how they procure this and store in their pattern medicine shop where they are not, according to PCN guidelines, they're not even supposed to stop them, but they will stop them and keep selling this to people without prescription. Will be tiring. You don't know if they harm they are causing to the society. You don't know. So they are frequently misused because they are being used without medical supervision, and some even abuse it too. Yes, some abuse it. There's a case of some group of boys, some close to 10 years ago or more than, some boys that lured a lady into a hotel and they grounded one of these benzodiazepines. I think that should be flu nitrazepam. They grinded it and put a drink for the lady. The lady drank it and they slept on. From there they did all sorts of nonsense to the girl and collected her belongings. The girl slept off. From there, the girl didn't wake up again. The person that sold the drugs to them, and those scammers, in fact I would call them ritualists. They entered into serious problem. Of course, I didn't follow the story, but I know that the person that dispensing, that is what I'm talking about, without prescription. So that one they did to that girl is no longer misuse, it's abuse, even though the girl did not consent to it. But it's still abuse, it's not a misuse. Because it's not supposed, they use it for something negative, not to help the girl to recover from any. Had it been they gave it to the girl to recover from maybe insomnia without prescription, you say it is misuse. But in that case, it's abuse. It's murder. That was murder. Alright, please, let's be careful. If you are working in a pharmacy, of course, it's only pharmacy that is entitled, that have what it takes to dispense or store these drugs, not packet medicine shop. If you are working in pharmacy, please don't dispense without a prescription. And you must record it in your poison book. Very important. Alright, let's continue. So, common problem associated with these sedatives and sleeping pills are drowsiness, poor coordination, memory impairment, dependence, and withdrawal symptoms. Again, withdrawal symptoms. To stop it, now withdrawal symptoms. So misuse commonly occurs through self-medicate, of course. If you self-medicate, it's misuse. If you are sharing prescription, it's misuse. I've discussed that in our last class. Now let's look at the next substance that is prone to abuse, commonly abused or misuse. Some can be misused. Inhalants. Inhalant. What are inhalants? Inhalants are chemical substances whose vapor are inhaled to produce psychoactive effect. So substances that you inhale their vapor to do what? Produce psychoactive effects. Examples, things like glue, petrol, paint thinners, even aerosol sprays. These are examples of inhalants. What are the health risks? The health risks are as follows: brain damage, organ failure, sudden death from respiratory complications. Yes, sudden death from respiratory complications. So inhalant abuse is a more, in fact, is commonest among adolescents. Why? Because they are cheap. They want to be high. They can go and inhale those, get fuel, inhale it and get high. Because of the cost, even though fuel is not expensive. And they are easily what? Accessible. Okay, let's note that point. So in a nutshell, drug and substance abuse remains a growing challenge within our communities. So while some substances have legitimate medical use nowadays, their misuse and abuse can lead to severe, even though yes, they can be used for something for use good. They can be used for health, to take care of our health situation. But their misuse and their abuse can lead to severe health and social consequences. So community education is very important. This is where we have a role to play as public health personnel. As public health students, we have an important role to play in ensuring that the community is well educated. Communities are well educated by going for outreach, health talks from one organization to the other, schools, name them, talk to them about this abuse, misuse. So, but if there is proper education, there will be early intervention, and there should be collaborative public health strategies, because it is very, very essential in reducing the burden of substance abuse. So, our lecture on the topic commonly abused drugs and substances in the community will end here. If you have any question, please feel free. If you are watching this video online, if you have any question, please drop your questions in the comment section. Then for my students, if you have any question, please in our next class ask your questions. That is, if you don't have anything to ask now, after going through the lecture materials or watching this video, if you have any question, feel free to ask. And God will bless you as you do so. See you next time.